You have your first session available. Tap OK to begin. Hi Matt, I'm Anna. I'll be your guide through this program. We're talking today because things in your life aren't going as well as they could be. Making changes can be difficult, but it can help to have support in trying out new things and challenging yourself. That's where I come in. There are many other programs out there. What's different about this one is that I will be guiding you through each session as you make changes to what you are doing. The health professionals I work with have developed this program based on cognitive behavior therapy, which is commonly known as CBT. You may be wondering what all those questions were for. Your answers have shown me that anxiety is the main problem for you right now. You might remember, I mentioned to you earlier that this program is based on cognitive behavior therapy. CBT is one of the most proven and effective ways to overcome depression and anxiety. As you work through this program, information will be available to you that will equip you with skills to overcome your current problem. Committing to this program and taking up some of the challenges is the first step in working toward seeing the changes you want in your life. This program is made up of 12 short sessions that will take around 10 minutes each. These sessions are available every 3 days, so that you can go away and put what you learn into practice. There is also a My Resources icon which is located on the left-hand side of your screen. This icon has interesting information about anxiety and depression and is where you can revisit sessions that you have previously completed. Our first task today is to put together your problem statement. Understanding and recognizing the problem, and all the areas it's affecting, can be really useful before you make any changes. We'll review this statement each week to track the changes you are making. The first step is to identify the main problem for you right now. What would you say that is? That must be hard, so thank you for telling me. Now, out of the following symptoms, which two do you experience most often? Okay, when do you feel these symptoms the most? Next, what part of your life does this problem impact on the most? When you experience these feelings, what is the main thought you have? Finally, in what way do you deal with these experiences? You've done a great job, thanks for all that information. Okay, now let's put all of this together to create your problem statement. My main problem is panic, which causes poor concentration and irritability. This happens when out of the house, and affects everything. When I think I'm not safe, it causes me to take medication. Okay, so how would you rate that problem today? 0 is no impact, 3 is having a moderate impact, and 6, it's having a serious impact. Can you let me know what you think about seeing your problem statement? That's great. Having a problem statement that you can review and look back on helps you to see the progress you are making to overcome the current problem. I'd like to spend today's session finding out about how you went with your exposure activities over the past few days. I'd like to hear about what went well, and what you may have found challenging. This is the first time you've tried this, so well done for having a go. How did you find the exposure activities? Okay, what did you find the most difficult about the exposure activity? Learning something new takes time and practice. Being aware of the part that gets in the way will help you improve the next time you give it a go. What part was most helpful before or during the exposure activity? It sounds like you're putting in the effort and finding out important information about what works best for you. Well done. Distractions and safety behaviors can be hard to shift. Were you aware of any that got in the way during your exposure activity? Okay, it may just be the exposure activity was harder than you thought it would be. This is really helpful information, and can inform what you do next, in setting up a more manageable activity that doesn't involve any safety behaviors. This was your first try at graded exposure, so give yourself credit for having a go. You've done really well.
How often did you feel that everything was an effort? How often did you feel that nothing could cheer you up? How often did you feel worthless? Thanks for answering those. That's all the questions I wanted to ask. Your scores are showing a 26% improvement in how you have been feeling, which is great. I'll ask you these questions again in a few weeks' time, so we can see your progress as you work through the program. To get the most out of your next session, put together a list of experiences that cause you anxiety, and rate each one from 0% to 100%.